prior to coming to JBS, I worked on a project that was initiated as the Food and Drug Administration, or FDA, was transitioning oversight of medication-assisted treatment and opioid treatment programs to SAMHSA, the Substance Abuse Mental Health Services Administration. And this is now probably 15 years ago, so that gives some context to how long the federal government has been looking at quality of care within opioid treatment programs. Since then, not only has the opioid epidemic exploded, so too have treatment options. So now primary care physicians and most recently nurse practitioners and physician assistants can go ahead and prescribe buprenorphine. So there are other treatment options as far as medications, as well as there are other areas or venues in which people can receive treatment, including primary care offices as well as opioid treatment programs. What's still lacking is the counseling, wraparound services with behavioral health integrated into that primary care setting or the opioid treatment setting to go ahead and deal with some of the emotional aspects of regaining life. And so when we worked with the patients directly, one of the key support services that they wanted was more group counseling, more individual counseling. They came in and the medication absolutely helped curb their cravings, but then they really needed to find some support services to help them re-engage in every other aspect of life. And those wraparound services were inconsistent at best across a lot of the opioid treatment programs and did not actually come into play to help an individual truly find their way back into recovery, because they got their medication, they took their dose, they swallowed their methadone, they went out the door, and then they were left pretty much on their own to try to figure out how to start to rebuild their lives after being addicted to either heroin or some other type of opioid. The delivery and integration with behavioral health is still definitely being developed across the field. But the infrastructure to have those systems talk to one another, to have the permissions in place so that individual providers could access those systems, and then to have the knowledge available to do the analysis that will really inform what's next with quality care is really going to be a focus in the next 5 to 10 years. JBS has been really built on providing services to community-based organizations and has been doing so around substance abuse and behavioral health for the past 30 years. And now we've got a nation that has multiple accredited opioid treatment programs, and JBS 15 years later still has that same contract providing that technical assistance to those opioid treatment programs. So we've really been committed to this area when it was first transitioning out of the Food and Drug Administration and really more into a behavioral health type of focus with the Substance Abuse and Mental Health Services Administration.